All right, this is our Chapter 8 podcast on the skeletal system. And what we're going to be reviewing today are the components of the skeletal system. We will talk about the bones that make up the skeletal system, the functions of the skeletal system. We'll talk about how bones are formed. Okay. We'll talk about the cells that are found in bone tissue. Talk about compact and spongy bone. So the skeletal system is made up of bones, joints, cartilage, and ligaments. Okay, remember that um, bone and cartilage are connective tissue, and so when you look at them under the microscope, the cells are spread way out, and there's lots of material between the cells. In bone, the material between the cells is a combination of mineral deposits like calcium phosphate and proteins like collagen, as well as organic materials such as osteoid. Cartilage is a little different. Cartilage contains a glycoprotein called ground substance in the material between the cells, which are called chondrocytes, and it holds on to a lot of water and resists a lot of compression. Okay, cartilage tends to be rather thin because the cells that are embedded in the cartilage rely on diffusion in order to get their nutrients, while bone can be rather thick, and that's because, as we're going to find out, the, the cells embedded in bone actually are connected to each other, and there will always be a population of bone cells near a blood supply, and because the bone cells are connected to each other, they can pass oxygen and nutrients back from the blood to all the remaining cells, and the result is they all have a lifeline, basically. Okay, ligaments are simply dense, regular connective tissue that attach bone to bone, and we're going to find out when we get to the muscle chapter that tendons are dense, regular connective tissue that hook muscle to bone. Okay, and we'll also learn about joints. Joints are places where bones meet, and they come in different functional classifications. A diarthrotic joint is one that moves pretty freely. An example would be something like your shoulder or your hip or your elbow. Okay, while a amphiarthrotic joint is one that's hooked together by cartilage, and examples would include intervertebral discs and the pubic symphysis, which is between the front part of your hip bones. And we'll learn about that a little bit later as well. And then synarthrotic joints are areas where bones come together like puzzle pieces, and these joints don't move at all. Okay. What does the skeletal system do? Well, it provides a frame for the body so that our soft tissues have something to hang around. It provides movement at structures that are called joints. It's a mineral storehouse. It protects our vital organs, right? Our brain and brainstem are inside our cranium, and our heart and lungs are inside our rib cage. Okay, and a lot of our urinary and reproductive organs are inside our pelvic girdle. It also makes blood, okay, in red bone marrow, which is primarily in the axial skeleton, which makes up the long axis of the body, and that would be the skull, the vertebral column, the rib cage, the sternum, okay, the sacrum and the coccyx. Most of those bones produce new blood, and that's important because the cells in blood wear out pretty quick, because a lot of the cells in blood don't have a nucleus and have no ability to repair themselves when they get damaged. Okay? For instance, a red blood cell only lasts about 120 days in circulation. The calcium in bone is important not just for building strong bones, but it's also critical in blood clotting. It's important for muscle contraction and nerve transmission. Okay? And the phosphorus in bones is used for a lot of things. It's used to make phospholipids, which are a membrane component. It's used to make DNA and RNA. Okay, and it's used in ATP. So all of this is critical, and you could think of the skeletal system as a big closet where we store a lot of this stuff, and when we need it, we sort of dissolve bone and release it into the bloodstream. You can classify bones based on their shapes. Long bones are longer than they are wide or deep. Examples would include the femur in your thigh, the tibia in your lower leg on the medial side, the humerus in your upper arm. Okay. Short bones are basically either rectangular or cube shaped, and they include the carpals in your wrist, the tarsals in your ankle. Okay. Flat bones aren't perfectly flat, but they have an arrangement where um, really dense bone called compact bone um, sandwiches a layer of less dense bone called spongy bone. Okay. Examples of flat bones would be the sternum, which is your breastbone, the bones of the cranium, your scapula, okay, just to name a few. And then irregular bones have unusual shapes, and they would be things like the coxal bone in your pelvis and the vertebrae. Okay. The two types of bone are compact or hard bone tissue, which is made of functional units that are called osteons, and spongy or soft bone, which is made up of struts of bony tissue called trabeculae. Okay, um, compact bone is made up of cells that are called osteocytes, and they're embedded in a matrix of calcium phosphate and collagen and osteoid. Okay, and they are isolated from each other in the sense that they're embedded in their matrix, but they have little tunnels that connect the chambers in which they sit, which are called lacunae. And these little connections, little tunnels through the bone, are called canaliculi. And what the osteocytes do, the bone cells, is they hold hands basically through these canaliculi, and that connects them ultimately to bone cells that are close to the blood supply, and that allows them to pass nutrients and oxygen around to all the other tissues. Um, Compact bone is found on the surfaces of all bones. Okay. Um, if we look at a typical long bone, if you look at the outside, the hard tissue on the outside is compact bone. Beneath that is the other type of bone tissue, spongy bone, and then deep to that is an opening or a tunnel called the medullary cavity, and that's filled with bone marrow, and in the adult that's usually adipose tissue, and so that's a way that we can store extra calories. Okay. Spongy bone is underneath compact bone, and it lightens the bone and serves as an area for hematopoiesis, where a place to make blood. Um, it, as a result, is frequently where we find red bone marrow, primarily in the spongy bone of the axial skeleton and in the tips of the humerus and the femur that are closest to the trunk. Okay. Um, it also distributes force that's applied to bone over a broader region, and that makes the bone less likely to fracture. So, important roles there. This is a look at compact bone, and you can see the osteons, right, with these concentric lamellae here, and embedded in the concentric lamellae are the osteocytes in little pits called lacunae, and you can see these little things radiating out. Those are the canaliculi, and those provide the cytoplasmic extensions, a way to connect to other cells across the way. And then there's a blood supply that runs through. The central canal contains blood vessels and nerves, and the perforating canals connect the central canals to each other. Okay? You can see the remnants of old lamellae between the osteons. They're called interstitial lamellae. The periosteum is the living membrane around the bone, and this is where osteoclasts and osteoblasts come from. The osteoblasts build the bone matrix and eventually become the osteocytes once they're embedded in it. And the osteoclasts dissolve the bone matrix and release the protein and the mineral component breakdown products into the blood. And then deep to that you can see some spongy bone, right? And if this were a shaft of a long bone, if we kept going inward, you'd find the medullary cavity. So what you're looking at here is just a typical structure of a long bone. You can see the diaphysis, which is the shaft, and the epiphyses, which are the ends of the bones. And the epiphyses are designated as either proximal or distal, right? The proximal epiphysis would be the end closest to the trunk of the body, and the distal would be the one furthest from the trunk of the body. The proximal epiphyses in the humerus and the femur have red marrow in their proximal heads, and that's used to make blood. The epiphyses are designated as separate from the diaphysis by a line. Okay, the epiphyseal line is where the lengthwise growth of the bone takes place up until the end of puberty, and then that stops with the formation of a ridge of spongy bone to replace what used to be a plate of cartilage in that region. And at that point, no more lengthwise growth is possible. The medullary cavity, you can see here, in the adult contains yellow bone marrow, which is basically adipose tissue, and the periosteum, which is outside the surface of the bone, is where the osteoclasts and osteoblasts come from, and it also supplies blood to the bone, as well as usually containing some nerves that go in there as well. The importance, of course, of the blood supply is to keep all the bone cells alive, and as we've already seen in compact bone, there's an extensive blood supply throughout. In spongy bone, it's the same idea, except that in hematopoietic spongy bone, the cells can live off the blood they actually make, whereas in spongy bone that does not manufacture blood, there's a lot of capillaries that go through there and supply blood to that tissue as well. The articular cartilage is hyaline cartilage, and it's at the ends of bones, and its purpose is to pad and protect the joints. It's rather thin because instead of a blood supply, it relies on diffusion from synovial fluid, which is a lubricating liquid found in joints, in order to get nourishment as well as diffusion of oxygen from the perichondrium, which is a blood supply that surrounds the cartilage. The different types of ossification just dictate the way that bones are formed. We'll examine that here.
Bone formation, also known as osteogenesis or ossification, is the process by which bone tissue replaces embryonic connective tissue to form the skeleton. From childhood to early adulthood, ossification lengthens and thickens bone. In addition, the process of ossification is used throughout life to remodel bones. There are two methods of prenatal bone formation. During intramembranous ossification, bone is generated on or within fibrous connective tissue membranes. As the process begins, mesenchymal cells differentiate into osteoblasts in regions called ossification centers. The osteoblasts secrete osteoid or uncalcified bone matrix. Over a few days, osteoblasts become osteocytes, and calcium and other mineral salts are laid down, hardening the matrix. The bone matrix develops thin columns of bone called trabeculae, which fuse to form spongy bone. Blood and lymphatic vessels grow into the surfaces of the newly formed bone and develop red bone marrow. Outside of the bone, a dense layer of connective tissue called the periosteum forms. Most outer layers of spongy bone are eventually replaced by compact bone, but the center remains spongy. Intramembranous ossification also occurs with skull bones in childhood. At birth, skull bones are separated by fontanelles, or soft spots, and sutures, immovable joints made of fibrous tissue. Fontanelles in the fetal skull allow for easier passage through the birth canal and rapid brain development. Up until adolescence, the fontanelles slowly ossify into sutures, providing the brain with greater protection. Endochondral ossification, the replacement of cartilage by bone, occurs in most bones of the skeleton. The process begins when embryonic mesenchyme condenses, forming the cartilage model, the shape of the future bone. The model grows within the fetus. Lengthwise growth is attained via interstitial growth. Width is attained via appositional growth. A nutrient artery penetrates the perichondrium, increasing nutrient availability to the cells. Osteogenic cells are stimulated to differentiate into osteoblasts. These cells secrete matrix beneath the perichondrium that forms a thin shell of compact bone known as the bone collar. As the perichondrium begins to form bone, it is now called the periosteum. The bone collar reduces diffusion to the cartilage inside the model, depriving it of nutrients. Capillaries grow into the disintegrating cartilage, delivering osteoblasts. The new growth forms a primary ossification center, an area where bone tissue will replace most of the cartilage. Osteoblasts deposit bone matrix, building spongy bone trabeculae. The growing model is gradually remodeled. The cavity fills with capillaries and red bone marrow. Ossification proceeds, forming the main portion of a bone, known as the diaphysis. Around the time of birth, blood vessels enter the epiphyses, the ends of a bone, forming secondary ossification centers. Secondary ossification differs in that no medullary cavity forms, and ossification proceeds outward. As a result, the interior of the epiphysis remains spongy. Secondary ossification leaves a thin layer of hyaline cartilage covering the epiphyses. This is known as articular cartilage, and it reduces the friction and shock in bone joints. The change to the epiphysis also forms the epiphyseal plate, a layer of hyaline cartilage that enables the diaphysis to grow in length.
So as you saw in the previous video, growth in the lengthwise direction occurs at the epiphyseal plate, which is hyaline cartilage that's continuously produced up until the end of puberty, at which point it's overtaken by the production of bone on the diaphyseal side of the disc. And at that point, there's no more tissue to convert to bone, and there's no more lengthwise growth. Hormones that affect this include human growth hormone. If we have excess production of human growth hormone prior to the end of puberty, we generate a condition called gigantism, where you get extremely tall individuals. And if you have a lack of growth hormone prior to the end of puberty, you can have extremely short stature, and that's known as dwarfism. If you have a burst of growth hormone after the end of puberty, then you have a condition known as acromegaly, where you get enlarged hands and feet, and the bones tend to become thickened. If you want to know what somebody looks like that has both of those conditions, think of Andre the Giant. Okay. Note that estrogen accelerates the process of epiphyseal plate closure. while testosterone does not do so as quickly, and that's one of the reasons why men are often taller than women. Okay? When we talk about widthwise growth, we're always talking about um, the the action of teams of osteoclasts and osteoblasts working together in order to remodel the bone in a way that supports the weight applied to it more effectively. Okay? The osteoclasts are going to um, basically dissolve bone and put those components into the bloodstream. They are multinucleate cells. They look a little bit like a jellyfish, and they make little pits on the surface of the compact bone called resorption bays. Okay, the bone builders are the osteoblasts, and they eventually become encased in their own secretions, where they mature and become osteocytes. And so this goes on throughout life in response to forces such as tension and compression and pressure. Okay, and the bone always remodels itself in such a way that it becomes more dense where the pressure is applied, where the force is applied, and that makes the bone much less likely to fracture. And that's one of the reasons why um, we encourage people 65 and older to do weight-bearing activity at least half an hour a day, because by that age, the dissolving of bone has outstripped the deposition of bone, and the bones have a tendency to become softer, and that's a condition called osteoporosis. And one of the ways to slow that process down is to do weight-bearing exercise. If you do weight-bearing exercise, the bone is able to signal the bone cells, the osteocytes and the osteoblasts, to basically step up their game and to deposit more bone and make it denser. Some important terms that you need to familiarize yourself with as we work our way through the skeletal system are shown here. Okay, I won't go through each one of these, but you'll see these repeated as we discuss different bones throughout this particular talk. And the importance of knowing them is, for example, if we're talking about a spine or a tuberosity or a trochanter, okay, or even a crest, we're usually talking about a place where a muscle will attach, okay. A foramen is a hole, and that's usually a passageway for nerves and blood vessels. Condyles and fossas are smooth surfaces that usually participate in joints, and that's due to the reduced friction that they provide. Condyles and fossas that participate in joints are usually covered in hyaline cartilage as well. Okay, so you want to commit these to memory. Like I said, I won't go through each one of them, but they're important for you to know. Here is a look at what happens when we fracture bone. Okay, in this section of the lesson, we're going to discuss the axial skeleton and the appendicular skeleton and the bones that make it up. And we'll talk about different kinds of joints and the movements that they provide. Remember that when we're talking about the axial skeleton, we're talking about the skull and all its associated bones, the hyoid, which is just under the mandible, which is your lower jaw, the vertebral column, and the thoracic cage, which includes the ribs and the sternum, okay, as well as the sacrum and the coccyx. Okay? So we'll start with a discussion of the skull, and you can see that here.
The human skull is made up of 8 cranial bones that surround and protect the brain, and 14 facial bones that form the underlying structure of the face and support for the teeth. With the exception of the mandible, the bones of the skull articulate with each other through joints known as sutures. Throughout the skull, holes known as foramina serve as passageways for blood vessels and nerves. Bones on the surface of the skull encase the brain, protect sensory organs, and serve as attachment sites for the muscles of the head and neck. These bones include the occipital bone, parietal bones, temporal bones, and the frontal bone, as well as the nasal bones, the zygomatic bones, the maxilla, and the mandible. Other bones become more visible only when looking inside the skull. The sphenoid bone makes up the anterior base of the cranium. It is a butterfly-shaped bone with a central body and two pair of laterally projecting wings. These wings form portions of the orbit. The body of the sphenoid features a depression known as the sella turcica, which houses the pituitary gland. Located between the orbits, the ethmoid bone makes up a portion of the cranial floor and also the roof of the nasal cavity. An inferior projection, the perpendicular plate of the ethmoid bone, forms part of the nasal septum. The crista galli projects superiorly from the ethmoid bone and serves as the attachment point for the falx cerebri, a dural fold. Extending laterally from the crista galli is the cribriform plate, a perforated area through which the olfactory nerves pass. The two L-shaped palatine bones form the posterior third of the hard palate, part of the nasal cavity, and a portion of the orbit. The small, thin lacrimal bones make up the anterior portion of the medial wall of each orbit. A groove known as the lacrimal groove helps to form the nasolacrimal canal, which contains a duct that allows tears to travel to the nasal cavity. The vomer is an elongated, plow-shaped bone that forms the inferior and posterior part of the nasal septum. The internal and external skull bones articulate precisely, forming an intricate structure perfectly suited to its functions.
So, sinuses are simply hollow chambers inside the bones that are situated throughout the body, many of them in the skull, that lighten the bone and provide a resonating chamber. The periorbital sinuses surround the orbit where the eyes fits in the eye socket, and they all attach to the nasal cavity. Okay, so that makes the bone lighter, provides a chamber that allows the voice to become louder when you talk. They're named after the bones that they reside in. And this is one of the reasons why when you get a sinus infection, you feel intense pressure behind your eyes. You feel like they're going to pop right out of your head because the infection can travel deep into these associated chambers and cause complications. Another important point is that we have to remember that there is a direct connection between the middle ear and the throat as well. And this is one of the reasons why frequently when you get a sore throat, you can get a bacterial infection that creeps up the connection, which is called the eustachian tube, into the middle ear, and that can produce a condition known as otitis media, or ear infection. And children are more prone to this because their eustachian tubes are shorter and straighter as well. Okay. In the infant, we have material between the bones of the cranium that's more flexible than bone itself. These are designed to allow the baby's head passage through the birth canal so that we can get the baby out, right? The head somewhat deforms on its way through the birth canal. The fontanelles, which we'll see in a minute, are basically connective tissue that has some flexibility and can deform without actually damaging the brain in most cases. Sunken fontanelles are sometimes an indication of dehydration in the infant. The sutures that will eventually form will replace the fontanelles. You can see them here. And they will then finalize the shape of the cranium. And at that point, we can't have any more changes in the intracranial pressure. Okay, we're going to point out that in some infants, the baby is born um, with a blockage in the fluid that bathes the central nervous system, which is called cerebrospinal fluid, and that's contained entirely inside the cranial cavity and the vertebral column. And if that pressure builds up in the interior of the brain, it can crush the brain against the skull, and that can result in coma and death. But in a newborn, because the fontanelles are still there, they can expand to accommodate the pressure, and you get an enlarged cranial vault, looks a little bit like a light bulb, and we call that condition hydrocephaly. Okay, what we can do to fix that is we can put a shunt, which is basically a needle and a tube, and then an outlet into the abdominal pelvic cavity, and we can drain the excess cerebrospinal fluid into the abdomen where the capillaries in the peritoneum soak it up, and the pressure can go back down to normal, and the skull can take on its normal shape. And we have to leave that shunt in. It's an entirely interior device, all completely in the inside of the body. We have to leave that in for the rest of the person's life, because in the event that they suffer another blockage of cerebrospinal fluid, there has to be a way for the pressure to be relieved. If this happens in an adult that doesn't have a shunt, then this could lead to coma and death very quickly. And this is also one of the reasons that we worry about bleeding into the brain, because of the increase in intracranial pressure. You could very easily crush the neurons of the brain, and that can send you into coma and death. The vertebral column is divided into different divisions. There are 7 cervical, 12 thoracic, and 5 lumbar vertebrae. Under lumbar 5 is the sacrum, and under the sacrum is the coccyx. Okay, there are several normal curvatures that we see in the adult spine: a cervical, thoracic, and lumbar curvature, which give the spine an S shape. Okay, and they reflect the fact that the weight distribution in the spinal cord is such that we have to support the head, okay, and then we have to support the weight of the trunk on the hips, okay, and so the spine takes on that particular curvature. Now, sometimes what will happen with these curvatures is that they can become abnormal, okay. You can have a curvature of the cervical and thoracic spine where it hunches forward, and that's called kyphosis or hunchback, and that's frequently seen in individuals that have osteoporosis. You can see lordosis, which is an extreme lumbar curvature where the lumbar division of the vertebral column sticks way out in front, and that's usually seen in people that are pregnant or obese. And then sometimes you get a sideways curvature in the spine, which is called scoliosis, and that can be due to having lower limbs of unequal length, or it can be due to defects in the vertebral column itself, such as abnormal ligament attachments or missing ligament attachments, or perhaps missing or fused vertebrae. Okay, so you can see the different divisions here. Notice that the vertebral column gets bigger as you go from top to bottom, and that's because it has to support more weight. Okay, and then between each of the vertebrae are intervertebral discs, which are fibrocartilage, and they allow a slight degree of movement in the vertebral column, and they are termed amphiarthrotic joints. Okay, because they're totally bridged by cartilage. If you put undue pressure on an intervertebral disc, such as bending at the waist and straining to lift a heavy object, you can force the intervertebral disc backwards into the spinal cord, and that can produce numbness and tingling from structures served by the nerves that exit at or under that injury, and those are called radiculopathies, and those are usually dealt with by chiropractors and osteopaths. At the very worst, it can produce paralysis. Okay, so this is one of the reasons why when you lift heavy objects, you always need to keep your back as straight as possible and bend your knees. You can see in the cervical division 2 special vertebrae. Cervical 1, or the atlas, which we'll see in a minute, forms a condyloid joint with the occipital condyles of the skull, and allows you to flex and extend your head, okay, which is, nod your head up and down, yes, okay, and it also allows you to tilt your head from side to side. The axis, which is underneath the atlas, which is cervical 2, has a vertical projection called the dens that forms a pivot joint with the atlas and allows you to laterally and medially rotate the head, such as when you shake your head no. Okay. Other portions that you can see here, we can start down here with a typical thoracic vertebrae, the body, okay, the vertebral foramen, the spinous and the transverse processes. These are the lamina, and down here these are the pedicles, okay. This is a superior articular facet, and on the underside, where the vertebrae stack, is the inferior articular facet, okay. And then you will have on thoracic vertebrae costal facets and demifacets. There's a costal facet here, and there's a little half dimple on the body, which is a costal demifacet, and that's where the tubercle and the head of the rib go, okay, because the thoracic vertebrae, of which there are 12, articulate with ribs, right? You can see the atlas and the axis up top. This is where the occipital condyles would rest. This is where the dens, where you'd form a pivot joint with the atlas. And then one of the unique features of a cervical vertebrae is the transverse foramina that allow blood vessels and nerves to go up and down from the brain in order to provide nourishment and to bring commands down and sensation up to the brain. The unusual curvatures in the vertebral column are detailed here.
Good. Curvatures have a downside, namely curvature abnormalities.
Curvature abnormalities can be blamed on any number of factors. Some are congenital, which means they were present before birth. Some are even caused by bad posture. There are a few common curvature abnormalities, like scoliosis, kyphosis, and lordosis.
Scoliosis, for instance, is an abnormal curvature that usually occurs in the thoracic region of the spine. That's the second region that forms the upper backbone. For some unknown reason, scoliosis is more common in girls and can sometimes be caused by having lower limbs of unequal length. Scoliosis can sometimes be treated surgically or with a body brace. Kyphosis is an extreme thoracic curvature, creating a condition known as hunchback and inspiring lackluster animated films. You can get this disease from rickets and tuberculosis of the spine. Lordosis is an extreme lumbar curvature and is commonly referred to as swayback. Lordosis sometimes affects pregnant women and individuals with potbellies. This is because people with potbellies have a tendency to thrust their abdomens forward.
The thoracic cage is made up of the true and false ribs, the sternum, and of course the thoracic vertebrae. Okay? The sternum has three parts. The topmost part is a heart-shaped structure called the manubrium, which contains a medial indentation called the jugular notch. The long part in the middle, which sits over the top of the heart and the thymus, is called the body. And the little tip on the inferior aspect is called the xiphoid process, and it's often used as a landmark during CPR, because you can, if someone's heart stops, use the sternum like a lever and act as a pretend heart until the EMTs arrive in order to resuscitate the patient. There's a total of 12 pairs of ribs. The first 7 are called true ribs because they have a direct cartilaginous attachment to the sternum, and the remaining 5 are false ribs. 3 of those false ribs are called vertebrochondral ribs because they attach indirectly to the sternum via 2 sets of cartilage. And then the last 2 false ribs are called floating ribs because they do not attach to the front of the rib cage at all. They only touch the vertebrae. Okay? The thoracic vertebrae, again, there's 12 of them, and we already detailed how they articulate with the ribs. So you can see the rib cage there, okay? The different structures. All right. Other thoracic cage structures include the xiphoid process, which we've discussed, the suprasternal notch, which is basically the jugular notch, the sternomanubrial joint, which is it's actually a saddle joint between the sternum and the clavicle, okay, and between the sternum and the manubrium. The sternum-manubrial joint is it's a little bend there, and it basically is called the angle of Louis, all right, and it indicates where the manubrium meets the body. Okay, the costal margins and the costal angles, important structures as well. The costal angle is basically the bend that the ribs take as they articulate, right? And the costal margin is where the ribs meet the costal cartilage. Okay, so that is a gliding joint in all the ribs except for true rib number 1, which is a direct cartilaginous attachment with no joint cavity. Right, there's a gliding joint cavity between the remaining ribs that are true ribs or vertebrochondrils, and the cartilage that attaches them to the sternum, and that allows the rib cage to flare out when you breathe in and out. Okay, this is a look at the appendicular skeleton.
While the axial skeleton protects the brain, heart and lungs, and spinal cord, the appendicular skeleton helps us move. The appendicular skeleton is made up of the upper and lower limbs. We usually call them arms and legs. It's also made up of the girdles of these limbs. The girdles attach the limbs to the axial skeleton. All the bones in the appendicular skeleton help us move and allow us to manipulate our environment.
Also, bear in mind that when we're talking about the appendicular skeleton, we're talking about duplicates. The bones of the legs, arms, girdles all have duplicates on the other side of the body. This is known as bilateral symmetry.
Region 1, upper limbs.
One of the many important bones contained in the appendicular skeleton is the pectoral girdle. The pectoral girdle is also called the shoulder girdle. So remember, even though we're only describing one pectoral girdle, there are two in your body because you have two shoulders.
The pectoral girdle attaches the upper limb to the trunk of the body and also anchors muscles that move the limb. Each girdle is made up of two bones, the clavicle and the scapula. The clavicle, or collarbone, is the anterior bone. The scapula, or shoulder blade, is the posterior bone.
You have 30 bones in each upper limb, each one of them useful, each one of them special in its own way. Why, without the 27 bones of your hand, you'd never be able to play an exciting game of skee-ball. And without the humerus, the radius, and the ulna, you'd never be able to carry home those exciting prizes you won playing skee-ball. Exciting prizes like whoopee cushions and decorative magnets.
I don't play skee-ball.
Well, you should. It's exciting, but not half as exciting as an in-depth discussion of the bones in our upper limbs.
As we said before, each of your upper limbs contains 30 bones, broken down into 3 parts: the arm, the forearm, and the hand. And these 3 regions can be broken down into individual bones. So let us now take advantage of the knowledge and experience of our elders as we turn to the Old Person's Learning Annex to learn about bones in the upper limbs.
It's the Old Person's Learning Annex, where we learn from the wisdom of our elders.
They say that the upper arm contains 1 bone, the humerus. It is the largest and longest bone in the upper limbs. Well, I will tell you, I do not find a lot of humor in this bone. It is not a funny bone. It is not funny at all. You see, the knee, that is a funny bone. You get hit in the knee, and it goes, ugh, and you go, oi, and you kick, and it's a funny thing.
The upper arm contains only a single bone, the humerus, whereas the forearm contains the radius and the ulna. The proximal ends of the radius and ulna, that's the ends closer to the trunk of the body, those ends connect with the humerus to form the elbow. Their distal ends, you know, the ends further from the trunk, they connect with the hand to form the wrist.
And now, the Old Person's Learning Annex, where long-winded stories serve us well.
I remember when my son Herb broke all 27 bones in his hand. I remember it like it was yesterday. He was 4. He's 32 now, and he's an accountant. He's so very, very good. Herb was out playing carpenter with his cousin Murray. Anyway, Murray, being the cute little idiot that he is, he took a ball-peen hammer and smashed Herb's hand. That's right. He broke all 8 carpals, all 5 metacarpals. Those are the 5 long bones that form the palm. And he broke all 14 phalanges. That's the fingers in the thumb.
So the hand is made up of 8 carpals, 5 metacarpals, and 14 phalanges. The 8 carpals are the bones that form the wrist, where we put our watches and bracelets. The 5 metacarpals make up the palm, and the 14 phalanges give us our fingers and a pollex, which is a fancy word for thumb.
There's the shoulder girdle, made up of the clavicle and scapula. And then there's the humerus, ulna, radius, 8 carpals, 5 metacarpals, 14 phalanges, and a whole lot of love.
And that's it for the upper limbs of the appendicular skeleton.
Region 2, lower limbs.
Now, some might argue that the body's lower limbs are more important than its upper limbs. These guys, for instance.
The lower limbs are far more important than the upper limbs.
No, they're not.
I'll get you like a fire!
Well, regardless of which set of limbs is more important, the pelvic girdle is the cornerstone of all lower limbs. You probably know the pelvic girdle as the hip, but you probably don't know it personally, so let us explain. The pelvic girdle attaches the lower limbs to the trunk of the body. It's also a point of attachment for the muscles that move the lower limbs, and it even protects sensitive organs like the urinary bladder.
The pelvic girdle is made up of 2 bones called os coxae, which connect posteriorly with the sacrum and the coccyx. You remember the sacrum. It's a division of the vertebral column. Each os coxa is made up of 3 bones, the ilium, the pubis, and the ischium.
The ilium forms the major superior or upper section of the os coxa, or where you rest your hands on your hips when you're preparing for a big cowboy gunfight.
The pubis forms the anterior and inferior, or lower front, section.
And finally, the ischium forms the posterior and inferior portion of the os coxa. This ischium is the bone you sit on when you sit.
Now the pubic arch is the angle between 2 pubic bones. It is inferior to the pubic symphysis, a joint that connects the 2 pubic bones. But don't worry about joints now. We'll talk about them later.
The pubic arch can be used to identify a person's sex. This is because the angle of the pubic arch in males is less than 60 degrees, and the angle in females is greater than 80 degrees. The pubic arch has a wider range in females.
Now, all the pubic girdle details aside, let's discuss the lower limbs, dude.
The lower limbs each contain 29 bones.
That's a lot of bones!
The lower limbs support the entire weight of an erect body. They have to be much stronger than the upper limbs so we can use them for jumping, running, walking, and devastating karate moves.
The lower limbs are separated into 3 regions: the thigh, the leg, and the foot.
The only bone in the thigh is the femur, which is the largest, longest, and strongest bone in the body.
The leg is made up of the tibia or shin bone and the fibula. Only the tibia bears the weight of the body, which is transmitted from the femur to the foot. The proximal end of the tibia, or top part, articulates with the femur to form the knee joint, which is protected by the kneecap, or patella. The distal, or lower end of both the tibia and fibula connect with the foot to form the ankle.
Notice any similarities? The femur is like the humerus of the arm, both long, both durable. The tibia and fibula are like the lower limb versions of the radius and ulna, and the ankle is like the wrist.
Next up, the foot contains 26 bones in 3 different regions. Those regions are the tarsals, the metatarsals, and the phalanges.
The tarsals are 7 bones that form the ankle. The metatarsals are 5 bones that form the arch of the foot. Finally, the phalanges are 14 long bones that form the toes. There are 3 bones in each of the 4 little toes and 2 in the big toe, or some call it the hallux.
And that's it for the lower limbs.
Okay. The pelvic girdle is made up of 2 coxal bones which articulate with the sacrum via the sacroiliac joint at posterior midline, and with each other at the pubic symphysis in the front, where the two portions of the bone known as the pubis will meet with a little disc of fibrocartilage between them. Okay. The pelvic girdle supports the weight of the body on top of the femur. It articulates laterally with the femur and medially with the sacrum. Okay. the coxal bone has three portions: the large fan-shaped ilium, the ischium, which you're sitting on right now, and the pubis, which is in the front. The acetabulum is simply the socket that articulates with the proximal head of the femur, forming a ball and socket joint, an extremely flexible joint that allows the femur to move in any direction. And the pubic symphysis is that fibrocartilage joint at the front of the pelvic girdle that the baby's head has to pass through during birth, right? This is one of the features that's acted on by a hormone called relaxin, which is released by the mother during the third trimester of pregnancy in order to soften up really cartilage throughout the body, but the goal is to soften up the cartilage in the pubic symphysis, and that allows the hip to actually expand as the baby's head comes through, and that lets you get the baby out more easily. Okay. Note that this is a hematopoietic bone. This is frequently the bone that's used when you do bone marrow donations, right? They'll usually pay you about $2,000 for a bone marrow donation, and they'll take a big needle and they'll stick it right in the crest of the ilium and withdraw some of that marrow, and then it'll be rather painful after that. So you have to think a little bit about that if you want to do it or not. Remember that the difference between a male and a female pelvis is that the female pelvis has a wider pelvic brim, okay, and it also has a greater pubic angle, okay. You see the pubic angle here and the brim here. This would be a female pelvis, okay. The male pelvis has a heart-shaped pelvic inlet and outlet and a much narrower pubic angle. You could see the three parts of the coxal bone here, okay, color-coded. And there you can see the differences between male and female, right? And then this is a look at different types of joints called articulations.
Articulation is a fancy word for joint. Joints are sites where bones join together to make movement possible.
Joints are divided into three different functional classifications based on the degree of movement they allow. These classifications are synarthrosis, amphiarthrosis, and diarthrosis.
Synarthroses refer to joints that are immovable. Synarthrotic joints just won't budge. They just lock bones together. These types of joints are found in places like the cranium.
The classification amphiarthroses refer to joints that are slightly movable. They're not rambunctious or hyper, but they do move a little bit. These joints are found in places like the vertebral column.
And last, but by no means least, the classification diarthroses refers to freely movable joints. These are the types of joints found in upper and lower limbs.
In addition to all this, joints can also be classified by their structure. The three structural joint classifications are fibrous joints, cartilaginous joints, and synovial joints.
The first structural joint we'll talk about is the fibrous joint. Some joints have little fluid-filled spaces between bones. These little fluid-filled spaces are called joint cavities. Fibrous joints do not have joint cavities. Fibrous joints are joints where bones are united by fibers of fibrous tissue at their joint sites. Fibers. Fibers. Hey, it's fun to say fibers. One specific type of fibrous joint is called a suture.
Now everyone has sutures in his or her skull. These sutures are made up of interlocking or overlapping bone edges that are connected by short fibrous fibers. The term fibrous fibers may sound redundant, but hopefully it'll make you remember the name of the fibrous joint. Two other types of fibrous joints are syndesmoses and gomphoses.
In syndesmoses, bones are connected at their joint sites by long fibrous cords or sheets. Fibrous, get it? You can find an example of this joint in the lower leg between the tibia and the fibula.
Another cool fibrous joint is the gomphosis. Gomphoses are the joints that connect the teeth to their tiny bony sockets in the jaw. They are attached with fibrous periodontal ligaments.
Are you catching a trend here? Fibrous joints use fibers. Another type of structural joint classification is the cartilaginous joint. Now, can you guess what substance connects bone to bone in a cartilaginous joint?
Cartilaginous joints are joints where bones are connected by plates of cartilage. Like the fibrous joint, the cartilaginous joint has no joint cavity. They are amphiarthrotic or slightly movable and are usually found in the axial skeleton.
You remember the axial skeleton. It's the skull, the vertebral column, the ribs. Yeah, you remember it. Well, a good example of a cartilaginous joint would be symphyses.
Symphyses are flat, frisbee-like discs of cartilage between the vertebrae. The proper name for these frisbees is intervertebral discs. Symphyses are also found between the vertebrae and in the pubic symphysis of the pelvic girdle.
The synchondroses are another fine example of cartilaginous joints. The synchondroses are joints made up of superflexible cartilage called hyaline cartilage. These joints can be found in structures called epiphyseal plates. Epiphyseal plates are found in long bones like the humerus and the femur. These plates allow for linear bone growth in places like your arms and legs. That's longitudinal growth.
The final structural classification is the synovial joint. These joints consist of bone ends that are separated by a joint cavity filled with synovial fluid. Synovial fluid is a liquid that reduces friction between bones. Synovial joints come in 6 exciting varieties: gliding, hinge, pivot, ball and socket, saddle, and condyloid.
The gliding or plane joint has a flat surface and allows for sliding movement in between bones. The gliding joints are found between ribs and vertebrae and in the joints of the wrists and ankles. The joints in the wrists and ankles are known as the intercarpals and intertarsals. Makes sense, doesn't it?
The hinge joint, found in the elbow and knee, is made up of the convex end of one bone that fits into a concave groove of another bone. Remember, convex bulges out and concave caves in. The hinge joint kind of works like the mechanical hinge you might find on a door.
The pivot joint is another important joint. It has a rounded surface that protrudes into a ring formed by a bone and ligament.
Pivot joints are found between your first and second cervical vertebrae, called the atlas and the axis. Remember, your cervical vertebrae are located in your neck, and the pivot joint is the joint that allows you to shake your head no.
The next major joint is the saddle joint. The saddle joint is found in the thumb and, oddly enough, looks kind of like a saddle. The saddle joint allows for both up and down and side-to-side movement.
You can find the ball and socket joint in both the shoulder and hip. It consists of a large spherical head that fits into a large concave cavity and allows for all types of movement, making it the most mobile joint. In fact, you remember the 3 functional classifications of joints? Synarthroses, amphiarthroses, and diarthroses? Well, the ball and socket joint is a diarthrotic joint because it's super mobile.
Finally, the condyloid joint, located in the knuckles and wrists, consists of a small condyle, or projection, that fits into a small depression and allows for side-to-side and up and down movement.
Well, there you have it. You are now a joint scholar. You know about the 3 functional classifications of joints, as well as the 3 structural classifications.
Joint injuries, joint disorders.
When studying joints in the human body, it is very important to take into account common yet very painful injuries. These include sprains and dislocations.
A sprain involves the stretching or tearing of a ligament, which unites bones at a joint. A sprain is extremely painful. Sprains can be partial tears or complete tears.
Partial tears heal very slowly because of lack of blood flow to ligaments. Complete tears must be repaired surgically, and surgery is very frightening, even if you can bench press.
Artificial ligament or a ligament from a cadaver.
Dislocations are also very painful.
When a dislocation occurs, bones are forced out of their normal position at a joint site.
Dislocation often occurs in shoulders, fingers, and thumbs. I have dislocated all 3. I am in constant pain. Dislocations are corrected by placing the bone in its proper position, a process that is very painful and very frightening.
Joint injuries are painful, but joint disorders are often prolonged and more serious. Arthritis is an example of a serious joint disorder.
Arthritis is a general term that refers to over 100 different kinds of inflammatory diseases. There are 3 common kinds of arthritis: osteoarthritis, rheumatoid arthritis, and gout.
Osteoarthritis is the most common condition. You remember cartilage, the flexible material found in joints and other places? Well, with osteoarthritis, cartilage is destroyed. When this happens, little chips of bone called bone spurs form, making movement extremely difficult.
Rheumatoid arthritis is another form of arthritis. It causes destruction of cartilage, fusing bone ends together so joints can't move anymore. You can imagine how painful that might feel.
Gout is a disease that's caused by a buildup of uric acid in joints. Uric acid is a natural bodily secretion, but in excess it can lead to the melding together and immobilization of joints. The most common joint affected by gout is the hallux, or big toe. Gout can be prevented by avoiding foods containing the nucleic acid purine, like liver.
Well, it shouldn't be that hard to avoid liver.
Sadly enough, we've come to the end of our journey through the skeletal system. You've learned about the axial and appendicular skeleton and familiarized yourself with the joints in those systems.
So you can see here some of the different joints throughout the body. Here in this figure, you can see the axial skeleton highlighted in pink and the appendicular in yellow. Okay. Examples of some joint names include the tibiofemoral joint, which is a hinge joint that forms the knee between the tibia and the femur. The humeroulnar joint, which is another hinge joint that forms the elbow. The metacarpal phalangeal joint, which is the joint between the palm of the hand, okay, and the fingers, all right, and that is a condyloid joint, and that allows movement in two axes, right? You can wag your finger up and down or left and right, okay. The glenohumeral joint, which is a ball and socket joint that allows movement in any direction, and the femorocoxal joint, okay, which is between the femur and the acetabulum, and that is another ball and socket joint which allows movement in any direction. Because the ball and socket joints can move in so many different directions, they are the easiest injured in the body, right? The trade-off is the more movable the joint is, the easier it is to damage, right? And you usually injure joints more often that are weight-bearing joints as well. Okay, this is a look at some different types of joint movement. Okay, please let me know if you have any questions. I'll be happy to get back with you. Again, email is my preferred method, and I'll see everybody in the next podcast. I thank you for listening.